Thank you, and thank you everybody. It's lovely to be here today from Dundalk Institute of Technology. So, as we were introduced, my name is Jean Carragher, and I'm one of the midwifery lecturers and first stage convener in the midwifery section in Dundalk Institute of Technology. And I have with me my colleague, Anita Byrne, who's also one of our team of midwifery lecturers and programme director for the undergraduate programmes. I'm also the first stage convener, which is one of the reasons why I'm standing up here today. And I'd also like to introduce our fantastic first year student midwives who have very kindly given up their day off from placement to come here to share their experiences of peer support and student partnership. So we have Sophie and Eimear here today as well. So as I say, we like to travel together from DKIT. We're a close-knit bunch, and it's a great place to be a student midwife and also a midwife lecturer. Now, I have spoken about my pals before. I was here in 2001. Now, not literally here because unfortunately that was online. So I'm really, really pleased that we're back face to face, and it's great to see people back talking and the atmosphere, etc. So thank you again for having us here today. So I've done the introductions, so I'll just speak a little bit on my pals myself, and then Anita's going to talk about our disciplinary excellence in learning, teaching and assessment, the Delta Award, which we received last year, and we're very proud of that. And we are very proud of our student staff initiatives in the midwifery section. And needless to say, we wouldn't be able to do that without our fantastic students, our lecturers, and also our wonderful clinical teams in the maternity units in Drogheda, in Letterkenny, and also in Cavan. So, you know, again, very close working relationships to make sure our students are so well supported in the main. So if you have heard me talk about my pals before, my apologies. It's a great opportunity to reflect back on this initiative. So my pals was an initiative that I introduced back in 2017 in the midwifery section. And it was born out of a desire really to see a more longitudinal approach to student support. Whilst we had a fantastic student ambassador scheme across the college, we didn't have a specific, discipline-specific student support project for student midwives that lasted over the whole term. And as we all know, a lot of the evidence does suggest that students need support along the way at particular times in the programme. So at each stage of the programme, it is very important that they do get support. So initially, our My Pals ran for the first term, and that is what we're running with at the moment and very much embedded into our curriculum. So it is undertaken in a very structured way, and as I say, the main aim was to help our first years settle into both college life, which is a big transition for all students, but also to the profession of midwifery. And a lot of the evidence does support the use of peer mentoring and peer support for entering into the professional disciplines like nursing and midwifery. So just a little recap on the organisation of My Pals. So we did embed it into specific curriculums. We wanted to make it part of the programme. We wanted to make it something that the students had to do. So it is compulsory. And although the evidence does suggest that most peer mentoring schemes are voluntary, I certainly felt after reading the evidence and thinking more about the midwifery role that it was important for our senior students to learn how to mentor students and to develop those skills in student support before they actually take on the role as a newly qualified midwife in the preceptor role. We do try to do a group format, which has been evaluated very well, and I do try to match students up together. So at the moment, our first year students are very closely mentored by our third year students. And as I say, I try to match them up in terms of mature students, school leavers, similar qualities, etc., so that they do they can actually relate to each other, and they can actually go across groups as well. And the group format is a little less stressful for the mentors than the individual one-to-one. It's just a little bit less pressurized because the group does come together and do have great chats. Now, it's not just about student support. We also do some peer learning as well. The core midwifery skills like abdominal examination, like learning the fetal skull and pelvis, like the basic vital signs. These are all things that our peer mentors have helped our first years with too, and that has been evaluated very well. But I do have to say the support is our main emphasis, and this is what the students have said in our evaluations. So at the moment, these are timetabled for one session, and we do it every week that the first and third years are in college together. And we're very grateful that the department has supported this, that it is timetabled, so that they do have time outside of everything else to meet up in a structured way. And, we do actually supervise and provide support, but in a bit of a distant way, because, again, feedback from the students was that they felt more comfortable asking questions from their peers that they wouldn't necessarily ask their lecturers. And if we're breathing down their necks all of the time, then it might not work quite so well. But we're certainly there for support, and if anything, particular, any questions or anything. And it is student-led. The first years will very much lead the way, and the mentors will support them in that. So I've already spoke on this really in relation to why my pals. Very important that first years are supported. We've heard this morning, about attrition rates, and certainly that first term in college is a very, very stressful, very exciting, but very challenging time. So certainly the students do report back that they do appreciate that support from their mentors. And I also evaluated it as part of my doctoral studies, which I undertook with Queen's University in Belfast. So that was one of the reasons that I started investigating this area further. And I'm certainly delighted that we have got my pals out of it. And the evidence out there overwhelmingly shows support, as I said, for peer support. There's many benefits for the peer mentors and peer mentees. Lots of the interpersonal skill improvement, the transition to college, the transition to professional life, certainly for the mentors, leadership skills as well. And even the most quiet of our senior students have said it has really, really helped them in developing those leadership skills in a quiet, focused way. So it certainly has helped. Now, I'm not going to say it's all been wonderful and positive. There are obviously challenges along the way. And, we have, I suppose, just dealt with those as they've come along. But in relation to the evaluation, the formal evaluation, I do still do a less formal evaluation after every MyPal cycle. But my formal research evaluation was undertaken using mixed methods. I won't go into the details on that today, but again, it was the surveys and followed up with qualitative interviews. And it did show that on the whole, the majority of the mentors and the mentees, first of all, enjoyed my pals. They got a lot out of it. They appreciated that time was given in the timetable for them. and they felt that it was a great initiative within the midwifery section. They felt their leadership skills had been enhanced, and as part of the process, both the mentees and the mentors had to fill out an evaluative self-reflection and consider how their skills had developed. The mentors also do have to write up a reflective assignment, so that's probably one of the disadvantages for the mentors, but it certainly does help them think about the role and reflect back on the role and consider how they have used their skills and their knowledge. And a lot of the feedback has been that they were delighted that they knew so much and that they were able to pass on this information. So the belonging and collegiality is also a big aspect for my pals, and belonging, as we all know, is so important. We all want to feel belonged, we all want to feel worthwhile, and again, this was something that my pals did help with. We're a very small team, as I said, so it helps cement midwifery across the college. We certainly make our presence felt, so it's great to see midwifery doing these initiatives and being at the centre of things. Again, as I say, there always are challenges, and any of the positive benefits are very reliant on the relationship between the mentors and the mentees. And it's a two-way street. The mentors and the mentees have to show commitment, engagement, motivation. So it certainly does not work as well unless there is full commitment from all parties involved. So again, COVID hit, so that was the biggest challenge, I suppose, but we did go online successfully. And I have to say that the mentors and mentees managed brilliantly with the online platform, probably better than any of the rest of us, but we're certainly very delighted to be back face-to-face with my pals, and the social aspect from the evaluation was one of the things that came out on top, that it was about meeting their peers and recognising them then when they were in the clinical area as well. So it's still a work in progress. We have a lot of work to do on it, and I'll speak a little bit more about that in a minute. We are hoping to embed it more longitudinally at key points during the midwifery programme, and this is some of the evaluation that the students have stated that they would like to see. So now I want to welcome Sophie and Eimear up to talk about their experiences of my pals. Thank you.
So, hello, my name is Sophie Murray and this is Emma Hearty beside me. We are both first year midwifery students that are here to tell you about our experience in taking part in the MyPals module in Dundalk Institute of Technology. Behind us here is a word collage of words that we associate with our involvement with MyPals. Words that we found stuck out the most to us were navigation, transition, guidance and partnership. This module was helpful with transitioning into college, as we found it can often be an overwhelming feeling for students coming into an unfamiliar place, but MyPals helped us to feel welcomed by other students who are once in our position too. The third year students helped us navigate all the things that were new to us, like the campus and the workload. The module allowed us to ask questions, and the third year students were happy to give us lots of answers and guide us in the right direction. They were able to reflect on what they did as a first year and give us suggestions as to what they would recommend after their own experience. We were able to ask any questions that we had, from simple things like the shoes to wear on placement, suggestions for accommodation, and tips for module assignments. These can feel really daunting when you've never had to experience them before, but we found that hearing student perspective really helped with this. The support the students gave us showed us from the beginning of our time within the college how strong the student partnership is, and we are definitely looking forward to becoming more involved as we continue our time in DKIT. We know as we progress with our course that they will be there to offer a hand of friendship and advice.
From a mentee perspective, MyPals gave way to a lot of benefits for myself and my fellow first-year students. The anxiety and fear that came with starting college, and midwifery in particular, was substantially eased through the activities done as part of MyPals. Student partnership is promoted as a result of communicating with the mentors during MyPals, and this also establishes respect between students. A session of icebreakers to commence the module was a perfect way to get to know the mentors better and have a bit of fun. The discussions held during the MyPal sessions gave the mentors and mentees an opportunity to get to know one another better and form a bond with each other, building trust and respect. It is very reassuring to see a familiar face in the corridor and someone to look up to and learn from. As someone who is very anxious when meeting new people or talking to someone I don't know very well, MyPals could be considered challenging from this point of view. However, after the first session, I was reassured that the mentors were fully intent on helping and guiding me. In every interaction with the mentors, I was treated with kindness. The mentors are very approachable, and having the opportunity to ask them questions during the sessions or outside of class time is a massive benefit. Their support and guidance gives us considerable confidence in the work we do on campus and on clinical placement. I speak on behalf of my whole class group when I say the MyPals module is an extremely useful and worthwhile module to engage in. I look forward to filling the mentors' shoes in the future. I know that if I have any doubts or worries, there will always be a friend to lean on.
So Eimear and I are also involved in Delta groups for the midwifery programme in DKIT. We have just started this journey and we are really looking forward to working with the students and staff to help improve the programme and student experiences. And Anita will tell you more about this now.
So, hopefully you can see, even from the conversation we've had in the last 10-15 minutes, the value of partnership and the way that in DKIT, within the section of midwifery, that we really, really want to embed a partnership approach with our students, with our colleagues, and between our students and other students. And this mirrors very much the partnership approach that we want to endorse and promote within midwifery. Another example, a really good example of this partnership approach, is the Delta Award. What I have on screen at the moment is the actual award. So this is a beautiful sculpture by Susanna Ishikova, and it's made of porcelain. If it wasn't made of porcelain, I would have brought it with me, but knowing my luck, I'd probably drop it and break it. But it is a stunning piece of work. And it demonstrates a boat, which is our discipline, which is midwifery, and it has figurines within the boat, all facing in the same direction, all travelling the same path. And this is a perfect example of what partnership means to us as faculty within DKT, how we view our students as partners, and how within midwifery, women and midwives are adopt a partnership approach in the care that we provide as well. So I thought that the sculpture itself was a really good metaphor for how we embed partnership with our students in midwifery in DKIT. So Delta is a process, it's an action, it's not a stagnant award in any shape or form. What we had to do to get the award was to create a plan of action that will enhance the learning and teaching experience of students within midwifery in DKIT. So getting the award was the first step in this very, very active process that involves students in every step of the way. What does it actually look like? What does the Delta process look like? For the clinicians in the audience, it probably looks a lot like a clinical audit. It involves us taking stock of what we're doing well within midwifery education and areas that we need to enhance. What are the pinch points or the weak points within our teaching and learning experiences for students? And the best people to tell us that are the students. So that's why we involve them and we use them, and they feed back to us in exceptional ways about what is working well and maybe what isn't working so well within the programs. So we take stock. We then look to the future. We acknowledge what we're doing well, and we continue doing what we're doing well, but we also look to improve what isn't working so much. And we make a plan, and that's where we are at the moment. We're actually constructing a plan and acting out on that plan, and our students are embedded within that. We have 9 students involved in the Delta project, 2 from each year of the undergraduate programme and 1 from the higher diploma in midwifery. And we have 6 members of clinical of faculty and clinical, and it's really, really important that we have our CPCs on board in this as well, and we have 2 CPCs from clinical sites on board in this plan as well. So So here are some examples of the action areas that we're currently working on. So we're looking at enhancing student engagement and success. So there's a working package looking specifically at how can we enhance student success and student engagement. And I'm just going to hand over to Jean briefly because she's leading out on this particular aspect.
Thank you, Anita. So I'm one of the members of this group and glad to have Sophie and Eimear on board with me as new members of that. So we have a group of existing students and also graduates that are on board with this action. And what this action plan is just about looking at what constitutes student engagement and student success within the section of midwifery and how we can actually encourage ways to improve those. So we have done a lot of work around this. We've looked at what it means to each of us and collaborated on that. And we have crafted definitions around student success and student engagement. And we're now making plans to embed those into the section going forward. So one of the plans to be implemented is that we're going to be implementing a student forum, which is going to be part of the Delta process, and they will feed back into the main Delta team. And also, My Pals is a big part of that in relation to ongoing student engagement. So we're going to be looking at, as I said before, embedding that further into the programme, and hopefully we will get commitment that it will go through the whole 4 years. So that's the hope at the moment.
And that's just one of our action plans. We have 5 action plans. 3 more are on screen. I probably don't have too much time to go into them, but essentially what we're looking at is enhancing how we deliver the programs, how we evaluate the programs, and our students are so key in telling us what's the best way to evaluate the program. The last thing we want to do is do an evaluation that becomes burdensome to students, where they're doing module evaluation after module evaluation without much consequence or meaning. So we want to make this a really, really valuable and meaningful process for everybody involved, including our students. We're also looking at enhancing the inclusive learning and teaching within midwifery. We know that our cohorts of students are changing. We know that more and more people are coming from disadvantaged groups, from priority areas, from people who maybe have a learning challenge, and we're welcoming them more and more within professional education. So we need to adapt to that. We need to adopt a more universal design for learning, approaches to teaching and learning, and that is actually happening actively within the section at the moment. And another action plan is we're looking at at feedback. What works for students? What doesn't work for students? What ways can we deliver feedback maybe that's more meaningful for students? And again, our group on that particular action is really, really beneficial. They are the ones that are creating surveys to put out to their fellow students, getting the feedback from their fellow students, and developing an action plan about how can we better deliver and work with and use feedback from our students. So it's a really, really important partnership approach involving students the whole way along. What we will say is the Delta process is a process. It's an action, it's activity, it's not an award for award's sake. We would absolutely encourage our colleagues in Dublin, in Galway, in Limerick and in Cork to consider applying for the Delta project, because it really does, particularly with the student involvement, it really does enhance the learning and teaching experiences of students. Thank you.
Thank you. Okay, so just to conclude our presentation, as I say, we're delighted that we were able to come back face to face, and just want to thank you all for listening, and we're delighted to have that opportunity to reflect on what we've done. We are proud of our staff-student partnerships. I'm very proud of all of our students who do put the work in and the effort in every day. You know, it is a difficult programme to negotiate, and they really do work so hard. And also thanks to our clinical partners and all of the faculty. And again, we want to keep working in this area, and we would welcome any input or any questions from anybody. So thank you very much for listening. Thank you.